I'm here with Dr. Kamal Patil-Sisodia, triple board certified endocrinologist, obesity med, all the things. All right, we just talked about hypothyroidism, meaning low. Now I want to talk about hyper, means that it's high. Now everyone assumes they're going to lose weight. Is that always true?
It's actually not, because if you are hyperthyroid long enough, the body starts breaking down your muscle for food sources. So my hyperthyroid patients lose a lot of muscle, and we know that muscle is what maintains your basal metabolic rate. So if you're losing muscle and your basal metabolic rate is going down and the hyperthyroidism is making you hungrier, I have some patients who come into my office and they are like big mad. They're like, I have hyperthyroidism. I have the one where I should lose weight. I should be losing weight. Why am I not losing weight? And a lot of times it's because they've lost muscle and there's a mismatch between how much they're eating and how much they're burning.
Okay, this is so interesting that you bring this up. I will never forget in primary care, I had a patient where this happened to her. She was highly anxious because of all the thyroid hormone excess, and she was also dealing with perimenopause that was starting.
Yes.
She also had weight gain and she wasn't sleeping. And I can go on and on. This lady, I felt so bad. We did a lot of things, but from what you're describing, she was so angry about that. I remember.
Oh yeah. I would be too, honestly. Yeah. Like if I'm going to get the condition that in the textbooks tells me that I'm supposed to lose weight.
Slim me down.
Like, come on now, cut a girl a break, right? But so I feel you, right? And it's very frustrating when you're in that situation and you show up to the endocrinologist and they tell you that, it doesn't always work that way. So we'll talk. Sorry.
Yeah. How would someone even know that they have it?
Oh, so that's a good question. Hyperthyroidism, so thyroid hormone in general sets the metabolic rate for your body in like every tissue in your body. So think about being hyperthyroid like you're hypermetabolic, like you're amped up on something you've had, and this is going to sound like a very trivial comparison, but like you've had way too much caffeine, right? That's
I'm glad you brought that up because I always said that in the past. That was what I would say.
A few patients be really offended by
Why?
that. And I'm not trying to say that you drink too much coffee.
I think they assume we're saying stimulant, and that's not what we're like. We're assuming that they,
So it's really like you'll get tremors of your hands where your hands are shaky. You'll feel palpitations. You'll see an increased appetite. Some people have more frequent bowel movements, or just like frank diarrhea. You'll feel hot, sweaty, and both types of thyroid dysfunction can make you lose hair. I'm sorry.
I know. Oh, yeah. Depressing.
So it is.
All right, on that positive note, make sure that you like this video.
And when people get treated, if they give enough time for things to settle out, because a lot of times we just want like an instant fix when we're feeling terrible, give it time, it will level out, and make sure you're talking to your endocrinologist the whole way through.
Yeah.
Bye.